Dear South Africans, what do you know about the National Health Insurance? President Ramaphosa recently signed the National Health Insurance into law, claiming that it will improve public health services in South Africa. The NHI requires a substantial increase in taxes. VAT, personal income tax, and corporate tax will face increases to fund NHI. But NHI also wants a new payroll tax on workers. These taxes will be channeled into the NHI fund, which is going to be a state-owned entity, a monopoly controlling all healthcare services in South Africa. The NHI fund, which will be similar to the Road Accident Fund and the Workmen's Compensation Fund, will be a single pot of money with hundreds of billions of rands going through it each year, exclusively controlled by the Minister of Health. In designing the NHI fund, the President and the ANC have claimed that the reasons that public health services are so poor are because there is not enough money or doctors in the public sector to deliver better services. So we asked one simple but important question: is this really true? When we examined the facts, we saw that the provincial public health budget grew from 30 billion rand in 2001 to over 240 billion rand in 2023. That's an increase of 800%, which is much higher than the growth in population or inflation over that same period. This massive increase in spending meant that the government could also employ many more doctors. In 2006, the government employed 140,000 doctors, nurses, and other medical personnel. But by 2019, that number had grown by more than 70% to over 240,000 medical personnel. If you are a South African citizen, would you not then ask why public health services have not improved over the past 20 years? The real reasons for poor public health services are because of the ANC's mismanagement, cadre deployment, corruption, and the lack of maintenance of hospitals and clinics. Since 2001, they have had plenty of extra funding to supply you with better healthcare. They have also had plenty more healthcare workers to deliver better healthcare to you. But this has not happened because these resources have been badly managed, stolen, or wasted. And it's not just us saying this. This has been repeatedly confirmed by the Auditor General, the Office of Health Standards and Compliance, as well as the Health Ombudsman. Let us not forget about the brutal murder of Babita Deokaran, a whistleblower on corruption. She lost her life on 23 August 2021 after exposing massive corruption at the Tembisa Hospital in Gauteng. In the face of the lies about public health resources and the rampant corruption that plagues the Department of Health, we urge you to think carefully about the NHI. The ANC wants you to pay new dedicated NHI taxes over and above increases in existing taxes so that the ANC can implement NHI. But their track record says that even with all these extra taxes, they will not improve your healthcare and that there will be even greater levels of corruption. On the 29th of May, we urge you to vote for a party that will better manage the country's health services and deliver better healthcare for you.